In today's video, we are going to be going over how to do a soapy spud enema. The first thing that I would do was check the order, see how much water that the doctor wanted in the bag, make sure that it's for the correct patient. I'm going to knock on the door, sanitize my hands, pull the curtain. I'm going to introduce myself. Hi, my name is Kate. I'm going to be your nurse today. The doctor did order you a soapy water enema, so soapy spud water enema. So we are going to do that today if that's okay with you. Okay, the things that I'm going to need include lubrication, incontinent pad, 1,000-liter bag, an isolation gown just to keep yourself clean, and some gloves. The doctor did prescribe 500 of warm water, so you're going to do that with the spuds and mix it up. You're then going to hang it on the IV pole just to assess, just to have it ready for you. You're going to assess his rectum. You're going to have him laying on over to his left side, and you're going to have his right leg over a little bit. His right leg needs to be bent. You're going to make sure that there's no hernias or anything. You're then going to lubricate the part. You're going to stick it in the rectum, 3 to 4 inches. Hold the bag, release the clamp. After the bag is empty, clean the area, pull out it, cover up, and try and let the patient know that they need to try and hold the fluids for 5 to 10 minutes. And then as soon as they have to have a bowel movement, you're going to go in there, let them go assess what you've seen, document it, and tell the doctor what you found to see if they need another enema.